Hello Canada, Haver Upley here. You've heard the news, you've read the headlines, and now it's time to see the big picture. While I normally open with good day, today I can't bring myself to say it. Not because I don't wish you one, I do, with everything I've got. But I need you to know that what I'm about to tell you is not easy for me to say. I don't do this often, I don't put myself into the opening of an episode. But today I'm asking you to let me be human for a moment before the story begins. Because this one lands different. Today we're going to talk about a peer-reviewed study that just confirmed what a lot of Canadians already knew in their bones, and what the people who made those decisions are going to do to make sure it doesn't cost them anything. But before I get into this, there's something I want you to know. Somebody reached out to Yakstack to tell this story, payment in hand, on haverupley.com. We refused, not because we don't believe in this story, not because we keep these episodes behind a paywall, and not because we don't value the people who support us. We refuse because this story is more important than a paycheck. And I need you to understand the toll that these stories take in just knowing them, and I need you to understand why we persist in bringing them to you. There are stories that are the reason this show was built in the first place. This is one of them. We're telling it because it matters, because all Canadians need to hear it. That's why Haver Upley exists, and no matter how hard it is for us to tell them, to even know them, and why we continue, I cannot lie. It's stories like this where we feel like the lights are fading, where it would be easier to just read the headlines, where it'd just be so much easier to fade into ignorance, because it would be easier if we do, why we go on. And we know it would be for you as well, but we started on this trail. For us. For you. And for people like Dan Hartman. We're not telling the full story here, but I must insist you listen, not because it's easy, not because these are stories you want to hear. It's because while history isn't repeated, it rhymes so closely, and we cannot let this go unheard or unanswered. If we do, it will happen again. Here we go. I want you to picture a hockey arena, any town in Canada. A kid, 17 years old, skates tight, helmet on, everything ahead of him. He is not sick, he has no underlying condition. He has never, not once, been identified as someone at risk from a virus, not this virus in particular. The data would call him exactly what he is, a low-risk individual. But the decision had already been made, not for him specifically. The decision was made at a level where 17-year-old hockey players in perfect health were just numbers on a spreadsheet. And the spreadsheet said, everybody goes. The mandate did not come with a pamphlet explaining the risk profile for his age group. It came with pressure. Stay home. Miss the season. Lose the scholarship. Lose your seat in the classroom. Lose your job. Or take the shot. So he did what millions of young Canadians did. He took the shot. What happened after is documented now. Not in rumor. Not in a comment section. Not in a story passed along over somebody's fence on the prairies. In a peer-reviewed study published in the journal Cardiovascular Research that examined what the carrot did to the hearts of young males. You know what I mean by carrot. If I want to keep this story up, despite all the evidence that's available, I still have to stick to euphemisms that kept people from being blocked, banned, and discarded as conspiracy theorists for the last 5 years. What it found is that everything we were told to dismiss, we should not have dismissed. For years, the official position was that carrot-associated myocarditis was mild, transient, rare, with no long-term consequences. The study says that position was wrong. Young males under 40 were carrying the highest documented risk of carrot-associated cardiac damage. Not a fringe finding, not a blog post. Published, peer-reviewed, documented, and the researchers who wrote it concluded that these carrots should be removed from the market. Let that sit for a moment. Now here's where I want you to pay close attention. Because this is not just about the study, this is about what happens after the study comes out. When a government makes a decision, and that decision turns out to have harmed its own people, there is supposed to be transparency and accountability. There is supposed to be a reckoning. What we are watching is something different. We are watching a judicial system that is working harder to protect the people who made the decision than it is working to support the families who are harmed by it. And the reason is not complicated. They'd be at fault, and let me be very clear about this, they were at fault. However, while the Court of Appeal acknowledged the devastating nature of Sean Hartman's death, Describing it as a tragic loss for his family and community, the judges concluded that the legal claims could not succeed. Central to the ruling was the finding that the federal government does not owe a private duty of care to individual members of the public when making broad public health decisions during a pandemic. Instead, such decisions are made in the interest of the population as a whole, often requiring difficult trade-offs that may carry risks for some individuals. No duty of care. Let these words rattle around with you for a moment. No. Duty of care. 4 words. In a court document. That ended a father's fight for justice. That is the system working exactly as it was designed to work. Just not for you. If they acknowledged one, then every mandate. Every job loss. Every family torn apart over a dinner table. Every Canadian from the Maritimes to the foothills who lost a friendship or a career or worse over a medical decision that was supposed to be private becomes something that somebody has to answer for. They know that. And they are choosing the protection of future messaging over accountability to the people they govern. Here is what accountability looks like. A government that made a mistake says, we made a mistake. Here is what we now know. Here is what we should have known then. Here is what we're going to do to make this right. That is not weakness. That is the entire reason governments exist, to serve the people, even when it is expensive, even when it is uncomfortable. Here is what is actually happening. Studies come out, researchers draw their conclusions, and the machinery that is supposed to translate that into justice translates it instead into delay, into procedural walls, into rulings that find somehow that the harm does not rise to a level that requires anyone to answer for it. Canada burned children under the guise that it was keeping adults warm. Sacrifices will save grandma, they told us. Don't be selfish, they relented. The government segregated friends, families, and communities. People lost their livelihoods over a medical decision, which has never happened in the history of this country. And now, when the science is catching up to what those people lived through, the system is being used to protect the system. If the decisions made during that period were the right decisions, then let the evidence stand on its own. Let the studies come out. Let the data breathe. Let the courts do their work without a hand on the scale. And if the decisions were wrong, then the people who made them need to be accountable to the people they serve. There is no version of this where the acceptable answer to this is silence. Dan Hartman was 17 years old, a hockey player from Beaton, Ontario. He was healthy, and he died. His father, Dan, has spent years searching for answers that the official position never gave him. Sean's story is the story of what happens when a government decides that the individual is less important than the repercussions of their policies. There are people who have not given up on getting answers. On Friday, April 24th in Calgary, at the Military Museums, Jason Lavigne is bringing The Shot, Dan Hartman's story, to the stage, with former Olympian Jamie Soleil and former Calgary Flames superstar Theo Fluery. If this matters to you, be there. Visit SupportSean.ca for tickets and information for this event and others. I'd like to tell more of the story, but I don't want you to miss the opportunity to see what's already been laid at your feet through The Shot, Dan Hartman's story. Watch it. Feel it. See what a father has been going through and see what has been denied. This isn't a lost paycheck for Dan Hartman. This isn't social media credibility. It's more. This is the loss of his son, and nobody being held to account. Show up in numbers, because we cannot let this be buried like child who was buried by his father. Because it's one thing when a society stops protecting its children, it's a whole new level of evil. When we're not only not protecting them, but sacrificing them to an altar of intervention that offers no accountability. Haver Upley, signing out.